common triggers or the things that parents or adults with parents and children or adults with atopic dermatitis should be just aware of as they're going through life, particularly foods, particularly environmental?
Well, the food element typically does apply to the child 18 months and below. It's rare that an older child and an adult will have a major food as a trigger. And honestly, it's the opposite that I think is a concern that I have in terms of food. Many times, and I can think of a child that I saw recently in the office who came to me because they knew I had a friend who had done well, and so they came to see me. This was a 4-year-old, had been under the attention of a pediatrician, and at age 2 had some blood tests taken to see if they were allergic. Now, a child with atopic dermatitis many times has a very high potential for allergy. That means an elevated IgE level. And many times when you do blood tests or skin testing, you'll come out with a lot of positive results. The bottom line is that those are not all important in terms of triggering the atopic dermatitis. But the pediatrician had asked this child to stop eating milk, egg, wheat, as well as soy and peanut. So a very restricted diet. The child couldn't go to a birthday party normally and have birthday cake, and was very, very much inhibited. And the child was being treated, every time they would flare, the pediatrician would prescribe oral steroids. So here you have this chubby little child who is now steroid dependent almost, because as soon as you come off the oral steroids, usually it will flare up again. And so the parent thought they were doing the right thing. They had given up on they'd been trying Vaseline on dry skin, and they just gave up putting on those topical steroids because compared to the prednisone, it didn't seem to do anything. So we had a disaster. So working through this case, we first said, let's get it under control. So we started the bottom of that pyramid. Let's start doing moisturizing. And for a very severe child, you might even need to do what we call wet wraps, a wet pajama and then a dry pajama on top of it. And they wear that to bed at night and with moisture, sealing in the moisture in the skin. Then we also started using some moderate strength in bad areas of the topical steroids. Then we titrated down to low strength. Once we got that child controlled, we then said, we're going to try adding foods back. And so we will add back, maybe we start with peanut or with egg, and we will try it for 2 or 3 weeks. If there's no flare, it's probably not important. The child can go back to eating it. So we worked our way through the entire list. Only milk was important. When we re-added milk, we saw that the rash did get worse. So for the next 6 months, the child continued to avoid milk. At the end of that time, we tried it again. And by this time, the child had lost that allergy, now was fully on a normal diet. The mother understood that Vaseline needed to go on if used only when the skin was moisturized. And then the child we didn't cure the child, but the disease was controlled, and the mother understood that the child could have a normal life. So in terms of foods, it's sometimes felt to be more of a trigger than it is because it's not understood. And of course, that's where the allergist comes in. We need to help those parents sort through these positive tests and this concern. We've already spoken about another tip, and that is everything should be fragrance-free. From the detergent to the fabric softener to the moisturizer, there should be no fragrance in anything. It is a highly irritating substance. Dry skin doesn't need to be exposed to sunlight to the degree that you get sunburn. Elements of excessively dry environments, excessively windy environments can all damage the skin. So you want to protect the skin barrier. So those are some practical things that parents can do. On the other hand, we have absolutely no evidence that taking probiotics, that taking special diets, or that other homeopathic remedies really have any effect in the management of atopic dermatitis. Now, there is some Chinese herbal medicine. People always ask about alternatives that in some studies in some countries have shown effect, but the majority have not, particularly in our more westernized countries. So that's not an advice that I would recommend patients do.